Hello, my name is Major Douglas Taylor. I'm a psychiatric nurse practitioner with the Behavioral Health Department at Madigan Army Medical Center. The winter months can be hard in the Pacific Northwest in regular times, let alone during the COVID-19 precautions. There's a reason some of your most beloved holidays fall on the darkest days of winter, to hopefully cheer you up. I know I personally took it pretty hard when the infection numbers went up, and I learned that my family and I weren't going to get to celebrate with grandparents, brothers, sisters, aunts, and uncles. That's why we need to talk about depression. Depression is another word for being really sad, and it's okay and natural to feel sad during these hard times. If it becomes a deep, all-consuming sadness that is occurring every day for more than 2 weeks, then it might be major depressive disorder. Other symptoms are a complete loss of joy, an emptiness, the loss of vitality, or loss of zest for life. Most feel both the deep sadness and inability to find joy in any part of life. Other symptoms include feeling hopeless, irritability, feeling worthless, lack of energy, difficulty concentrating, decreased appetite or weight changes, and for many, thoughts of death or suicide, which can be on a spectrum of wishing you didn't wake up in the morning or planning how to kill yourself. Depression is one of the most common mental health disorders in the U.S. A lot of things can cause depression, including genetics, biological, social, and psychological factors. It can happen at any age and to anyone. Right now, because of the stressors caused by the global pandemic, like social isolation, fear, job loss, limited travel, we are all at higher risk for depression. Whenever we face heightened levels of stress and challenges, it's always important to take a step back and check in on our physiological well-being. Are you eating enough food each day to cover your caloric needs? If you have lost your appetite and food no longer tastes good, people tend to find liquid calories like protein shakes or smoothies easier than solid foods. The important part is that your body needs enough calories to fuel itself. On the other hand, eating too much junk food can lead our bodies to feel tired, worn out, and crummy. So look into ensuring you are eating enough fruits, vegetables, and fresh food. Second, ensure you are getting exercise. It doesn't have to be much from a mental health perspective. Just 15 minutes of sweat on average each day. Think of exercise as washing your brain. The increased blood pressure and heart rate help clear out neurological waste that can accumulate. Additionally, protect your sleep as much as possible. If you're having trouble sleeping, remember to keep a consistent wake time each morning. Don't go to bed until you're tired, and don't lay in bed longer than 15 to 20 minutes if you're awake. After you've checked in on your physiological health, it's time to address your social well-being. Depression will make you want to be alone and avoid people. But if you want to claw yourself out of it, you need people. We as humans are social animals. Unfortunately, right now, it's difficult for us to gather and be together. So try calling your friends and family. It might feel like you are forcing conversation at times, but it'll be worth it. Also, one of the most effective social interactions are small pleasantries with strangers. I know small talk can be uncomfortable and annoying. What I'm talking about is showing gratitude, such as thanking the receptionist for helping you and complimenting them on their care, or telling the barista through the drive-through window that they have nice glasses, or you appreciate their quick service. It's important to find something that is true, but it can be any small thing. I started this conversation by talking about how depression is a loss of vitality, and everything I just mentioned takes work. It is hard, difficult, and tiring. Doing all of that won't make you happy tomorrow, but it'll help you on your journey to feeling better. Frequently, we are just not able to pull ourselves out of depression on our own. If you're struggling, please reach out for help. If you are active duty, you can call your behavioral health clinic and schedule an appointment without a referral. Or if you're in a crisis, you can walk into your clinic during business hours. If you're a TRICARE Prime family member, you do not need a referral to see behavioral health off post. Call clinics to learn if they accept TRICARE. Or you can ask your PCM to make a referral to Child and Family Behavioral Health Services at Madigan here. If you are a civilian, talk to your doctor and look into your insurance program to learn what type of support is available. If you are feeling like you are a danger to yourself and the desire to kill yourself is becoming overwhelming, please reach out for help. Call 911 or a crisis line. If that doesn't help, walk into your behavioral health clinic, or if after hours, the emergency department. Please remember, you are not alone. We are all going through a very difficult time. It can feel like you've felt this way forever, or you will feel this way forever. But that isn't true. It'll get better, and you will feel sunshine on your skin again. Be well, and thank you for listening. Care with compassion.